Some patients, very early stages, they will identify froth in the urine because of protein leakage. Dipsticks, you just have to, like how the urine pregnancy test we see, like that you have to just dip the stick, which one small strip will come, that you have to dip in the urine. Whatever you try, it will be going into further down and your kidneys will ultimately fail. That's why early detection is important. Usually alcohol doesn't have any direct role in the kidneys. Even one smoke per day also there is a significant risk. Only main food that is bad for kidney health is salt. Once kidney stage goes to 4 or 5, there is no going back. One in 1,000, 1 in 2,000 kids by birth, they will have either one kidney or only one functioning kidney. Even patients with the kidney disease should not take excessive protein. Particular risk factors: diabetes, hypertension, obesity, family history, stone disease, urine infections, or any kidney disease, they have to check irrespective of age group.
Hello and welcome to the show Health for You. I'm Chetna Belgir. Heart health, everybody talks about it. Brain functions, there is so much of research happening. Kidney health, that is something which not everybody mentions unless there is a problem with it. Why does that happen? To discuss that and to know what would happen if you really do not take care of your kidneys, which actually filters gallons of blood. Let's find out more with all of these information. We have with us Dr. Ganesh Prasad. Thank you very much for joining us, sir.
Thank you.
Sir, first of all, my first question to you is, what would you be if not a doctor?
Maybe I might be taking care of my father's business in my village.
Oh, really? That's interesting. What was that?
My father had a one small cloth store in my village.
Okay.
So, yeah.
Well, that's very interesting, sir.
Yeah.
So if I tell you, like I told in my introduction, kidney health is something which we don't really focus on it unless there is really a problem with it, right? But first of all, if we have to discuss what is the role of kidneys, if I tell you that you should explain it to me in 60 seconds, how would you do that?
So many people, not all common people might, especially who have read biology, they might know kidneys filter our blood. So they know just kidneys clean our body. So that is everybody know. That is the most common thing. It removes all waste products in our body. Apart from that, there are other important functions of kidney.
Okay.
Like the first and foremost thing is it maintains our blood pressure.
Okay. Not many people know about it.
Yeah. Many people, like if they have blood pressure, they will go to physician, or most if it is not controlled, they will go to heart specialist. See, blood pressures, one of the most common cause apart from essential hypertension, like that is what is called as primary hypertension, which comes from either because of we are aging and because of genetics. There is some other causes like secondary hypertension, because we get blood pressure at very young age because we have some other problems like kidney disease or some hormonal problems like thyroid disorders or steroid hormonals like adrenal problems, these things. So one of the kidney's main function is to control your blood pressure within the normal range.
Okay.
Any patient with kidney disease, the first symptom they will get is high blood pressure.
Okay. That is the reason why they actually get high blood pressure.
Yeah. So most of the patients, young patients like 20 years, 30 years and all, they will come. They will come to us in very late stage when complete kidneys are failure. And they will think their kidneys are damaged because of high blood pressure.
Okay.
But most of the times in young patients, it's the reverse. Like 20 years, 15 years children also, 20 years, 30 years, young adults who are in working group, no comorbidities, nothing, they will get young hypertension because they have kidney
problems.
problem.
Okay.
Because of kidney problem, they will develop high pressure.
Oh, this is interesting. I think we should discuss more on this
Yeah.
little later. So today we are discussing, as we talk, it's World Kidney Day as well.
Yes.
So, what is the importance of it, and also the theme of 2025? What is it?
So, this World Kidney Day, the theme is "Are your kidneys okay?"
Okay.
So, why this theme and why World Kidney Day is, many people doesn't know about kidney health till they get affected.
Correct. Yeah. That's
Huh?
true. That's true.
So, because kidneys is like if you have heart attack, you will get chest pain.
Correct.
If you have brain stroke, you will get paralysis. So, other vital organs like heart and brain, you will have symptoms which are immediately visible, recognized. But kidneys, this has very unique feature. Even though patient is in very severe stage, also they don't get any symptoms.
That's interesting. I think that if that is the theme of this year's.
Yeah, that's why the theme is "Are your kidneys okay?"
So let's
that
find
early
out, sir.
detection.
I think now let's find out if there are any tests that you can do at home itself. I know that it
Yeah.
might be difficult. I'm sure the diagnosis makes a lot of difference.
Yes.
But first of all, primarily to know if my kidney is healthy, are there any primary things that you need to notice for when you're at home? Like, this is nothing to do with your diagnostics, but I'm talking about some things that you can do to actually check your kidney health at home. Can you do that?
So, few things which we can see is, first is history.
Okay.
So, in the world, 50% of kidney disease is because of diabetes. The second cause is presence of hypertension, as I said previously also.
Yes.
As I said previously also, many patients with kidney disease will have hypertension. So, these the two main signs. So, any patient with diabetes and hypertension, they are at risk for kidney disease. These two are the major junk for what we daily routinely see for kidney damage. So, apart from these two, patients with kidney stone diseases are patients who is getting recurrent urine infections.
Okay.
Such and recurrent urine symptoms like frequent passing urine, then they should suspect whether they had any kidney disease, and they should consult the doctor, and any family history of kidney disease.
Okay. So basically, you're saying that to look at your kidney health. One is frequent urination if somebody is having, or the pain in while urinating.
Yeah.
These are some of the symptoms of indicating that there could be some problems with the health. Any other symptoms that they can notice for
other symptoms is
other than the people who are at risk? That is, one is diabetics, and the other one, the people with diabetes, and the other one is people with hypertension. Other than this, any other symptoms as such that they can notice?
Other symptoms as such is a simple generalized fatigue can be also a kidney disease.
Okay.
And not able to eat properly.
Okay.
Their appetite is reduced. In severe renal failure, what we call as uremic gastritis. In that, the moment they see food, they will get vomiting sensation.
Okay.
In a severe failure patient, not in the very young early. That's what I'm telling. 90% of kidney patients are asymptomatic in early stages. Only in the late stages they will get symptoms like not able to eat and vomiting sensation and swelling of the legs. Some patients, very early stages, they will identify froth in the urine because of protein leakage. If the protein leakage is very severe, they will see after they go to toilet, they will see froth. They won't not able to easily flush. They will observe that there is more froth in the urine.
Okay, that's interesting. So once we see that there is some kind of symptom, or even otherwise, if you want to do a regular check of your kidneys, which are some of the basic tests to do this?
So, kidney disease, there are two tests which is most important, and every high risk patient has to be done regularly. One is in urine, as I said, froth because of protein leakage. So even before your kidneys start getting failed or start getting damaged, the first and foremost you see is detection of protein in the urine. Detection of protein in the urine. This is very simple test and it can be done. You don't need any high-end sophisticated labs. Even at most of the children and all also, we teach their parents how to check at their home also. There are even one dipsticks. You just have to like how the urine pregnancy test we see, like that you have to just dip the stick, which one small strip will come, that you have to dip in the urine. There will be a color change if you have a protein leakage. And then further test you can do what is the estimation, how much protein is there, and all further we can do it. This is one first this thing. Second is what is the how much is the function capacity of the kidneys. So kidneys disease we divided in 5 stages. Stage 1, 2, 3, 4, 5. 1 to 5 stages based on the filtration capacity of the kidney. So a normal kidney will filtrate whatever is there around 90 ml per minute. The filtration capacity of the both kidneys is both combined kidneys is 90 ml per minute. That is normal. So 90 to 60 you have to be careful. That is where stage 1. Above 90 is normal. So then 60 to 45 and then 45 to 30 and then 13 to 15. Less than 15 is where called complete kidney failure. So why it is important to divide is to see how severe is the kidney problem and is it reversible or not. So in the first 3 stages you can stop the kidney problem or you can reverse it completely. You can cure it or you can slow down the kidney damage. But once kidney damage is gone into stage 4 or stage 5, there is no going back. Whatever you try, it will be going into further down and your kidneys will ultimately fail. That's why early detection is important. So how will you do this filtration capacity is very simple. We'll calculate it by measuring something called as serum creatinine. This is also a very simple test. It doesn't cost you also, the cost is also very less. And it is also easily available in every nook and corner across the country and across the world. Any lab also. This is a simple test, not a hi-fi. And
it's a blood test, right?
It is a blood test. In the blood, you will check the creatinine level. Based on creatinine level, based on gender of the patient and based on the age, we will calculate how much is the filtration capacity. So serum creatinine and urine protein, these are the 2 important tests. If these 2 are normal, you can ensure that 90% of your kidneys are normal. You don't have any problem. You need not to worry about your kidney health.
So these 3, if you're looking at the diagnosis, how many, is there any time like, every 3 months I need to do, every 6 months or yearly once? Anything of that sort?
A general young healthy patient maybe one time we have to see, and then maybe after the 2, 3 years, 5 years also is okay. But patients, as I said, with diabetes or hypertension or previous kidney stone disease or previous kidney disease or any family history of kidney disease, such patients has to check once in a year. Once if they found to have they has kidney problem, then they have to check once in 3 to 6 months.
So is there any age group or is it just these risk factors? Is it
so these are the particular risk factors: diabetes, hypertension, obesity, family history, stone disease, urinary infections or any kidney disease. They have to check irrespective of age group. But all other, at least about 35 to 40 years, they have to compulsory check.
What are some, you talked about different stages and all. What are some early signs of warning that your kidney is getting into trouble? One is the froth, you did mention on that. Any other? What are some
Nothing.
of the other?
That's what I'm telling. 90% of people, you don't get, even in, if patient is in severe stage 5 CKD, they will be just walking into the OPD normally, they will go to some physician saying, I'm feeling some tiredness or my BP is not getting controlled. We see 50% of cases in our OPD daily in with end-stage kidney disease knowing first time.
Must be a shock for them.
Yeah,
right?
that is it is very difficult to counsel the patient that your kidneys are not working well and you need dialysis for the first time they come to know. It's very shocking news also, and it is very difficult for them to accept it.
Correct. So, what are some of the causes of these kidney problems other than the diabetes and hypertension? The regular lifestyle, does that have any impact
No,
at all?
see, a lifestyle again leads to diabetes
Yeah, it's
and
all like
hypertension,
a circle.
and it's a vicious circle.
Yes,
It's not like that. Apart from that, the most common causes, especially in young, like 20, 15 years, children and young adults, we see is what is called as glomerular nephritis. So, what this glomerular nephritis is, in kidney, the filter, how the blood filters is, there are some structures called nephrons. These are the important filters, like how our RO will have that filters will be there. So each filter will receive some blood and it will filter the urine and all, it will clean the blood. So whenever there is a damage to these filters, then your kidney will start getting damaged.
Okay.
So this filter cleaning doesn't happen. Like how you have a RO system in your house, after a 6 months or one period, you have to be keep recycling the RO filters, whatever that. If you don't do that, you will get high TDS water. So similarly, if these filters are getting damaged, is getting dead, you can, as you see, these nephrons, as after 40 years over a period, your nephron number also will go down.
Okay.
It will die off.
Okay.
The cells will die off. So as the nephron number goes down, the filtration capacity of the kidneys goes. So the creatinine in your blood rises.
No, but is there any reason, external factor for this to happen, or is it because of some family history?
Some are like more, not family history, it is like autoimmune conditions.
Okay.
So it is like a immunity related problems. Like for people to understand in simple how what is the immune diseases is, our own police or our own military which is there to protect us, instead of protecting us, they will misrepresent as thief or villain, and it will attack our own organs. That is called immunity. So because of some miscommunication between our immune system and our body organs, this will get affect. That is leads to damage to these nephron filters. That is called, we call as glomerular disease. Okay. So these glomerular diseases are, why it is important is many people doesn't know about these glomerular diseases, and many people doesn't have fear about any procedures if we say. So diabetes and hypertension, if you do whatever you do, once kidneys damaged because of diabetes hypertension, there is no permanent cure because of damage of kidneys to diabetes and hypertension. But glomerular diseases, if you detect in the early stage,
you can reverse.
You can cure completely also.
Okay.
Sometimes you may have to take treatment for long, like 3 to 5 years, but you can completely cure it also. Your kidneys will be perfectly fine if you detect in a right time. For that, we have to do run some sort of test like kidney biopsy, where we take some small tissue of kidney and see what type of immunity problem, what type of glomerular disease is there, and how severe it is there, and what type of treatment we can give. That will give one idea how we can treat it, and how long patient has to be taken treatment, and we can cure major chunk of kidney problems in young patients without diabetes and hypertension.
Okay. So you did talk about obesity per se. So, is there anything at all to do that, we can actually maintain that our kidney health is fine?
Yeah. So apart from diabetes and hypertension, obesity per se directly damages kidney. Because when your body mass increases above significant BMI, like more than 35 and all, then there will be enormous load on your kidneys to filter more blood, and slowly that pressure over a period, the tear off of these filters which I showed, it will get faster. As I said, for every individual after 40 years, these nephron cells will start dying over a period. Slowly it will start dying. But if you have obesity, it will start dying at very young age, maybe by 30 years only, and it will die fast also.
Okay.
Like every year in a normal individual, it will die at a rate of 1%, 2%, but in this case, it may die at 10%. So it is going to fasten your kidney problem.
What
Obesity
about
per se.
alcohol, sir? Does
So
it play any role at all?
No, usually alcohol doesn't have any direct role in the kidneys.
Okay.
Through only alcohol will lead to obesity and diabetes, hypertension, that will lead to kidney disease, but it doesn't have any direct effect.
Oh.
But whereas smoking, it has a direct effect.
Okay.
Smoking, that's why even one smoke per day also there is a significant risk. It will accelerate. It is like smoking, like is your N2O. Like for racing cars, how they put nitrous oxide to go fast. Smoking is N2O for your kidney damage. If you smoke, your kidney will get damaged much faster.
And anybody for that matter?
Anybody for that matter.
Okay. So, that is a major risk
Yeah.
as well. Okay.
Smoking is major risk. It has direct effect on the kidney health.
Okay. So, we spoke about diabetes, people with diabetes and hypertension. So, is there anything separate that they need to do to take care of their kidney health?
So first and foremost is they have to detect early diabetes. So everyone have to undergo above 18 years. We are now seeing because of childhood obesity and all, even in 13, 14 years also we are seeing type 2 diabetes.
Yeah.
Few decades back in children we used to see only type 1 diabetes. Now we are seeing even 13, 14 years also type 2 diabetes. So nowadays it should be must above 18 years, as long as they are eligible for vote, they have to check for diabetes.
Yeah, right.
That is must. So once they detect diabetes, they have to control it. Many people will have this hours to, especially young people. Now we are seeing more and more young onset diabetes, as I said. They feel I'm very young, I'm already got diabetes. If I take tablets, it will affect me further. That myth many people will possess.
Yeah, they don't even start on medication.
That is the problem.
Yeah.
So it is okay if you don't start medication, but the overall concept, whether you take only diet, whether you want to do diet and exercise, whether you want to do diet, exercise, tablet, 1 tablet, 2 tablets, 10 tablets, tablets and insulin, whatever you want to do, your ultimate goal should be sugars should be within the guidelines. Like it should be before food, it should be less than 110. After food, it should be within 130 to 140. If you keep that range, even if you have diabetes, your kidneys won't get damaged.
Okay.
So, and it is very important, you have to, many people, unfortunately, once kidney damage gets start, then they will try to control the sugar. So, but there is no point. Once your kidney, it is like wildfire. If because of your diabetes, if your kidneys start getting damaged, as I said previously also, once the damage starts, there is no going back.
Okay.
You can
So,
maybe
is there any level of diabetes that your blood sugars are so high and that is why the kidney is getting damaged?
No.
Or nothing like that?
Nothing like that. If it is more than the stipulated levels, over a period, if you have for 5 years, diabetes is around even 160, 180, like that also, you are going to get kidney damage.
Oh.
Maybe, like if you have 300, 400 levels, then within 3 years your kidneys will get damaged. If your sugars are around 180, 200, it may take 6 to 7 years.
So if this connected, you need to ensure that the diabetes is under control for sure.
Yeah.
Okay. So you discussed about diet,
Yeah.
which becomes very important. So there is so much of information on Instagram. You
Yeah.
see that there is
Yeah.
reels over reels on this is a good diet for kidney health. This
Yes.
is so. Is there anything like that at all? Is there any particular diet that you suggest is good for kidney health? If there are, let's plate it like this. Are there any good food that is good for your kidney health? Are there any food that is bad for your kidney health?
So only main food that is bad for kidney health is salt.
Okay.
Salt is the very bad
Culprit.
for your kidney health. So everyone, there is one saying in Hindi, एक चुटकी नमक जिंदगी के लिए.
Yeah.
जिंदगी के लिए एक चुटकी नमक. So per day 5 grams of salt, that should be the limit for each person should take, not more than that. So that is the only direct benefit of kidney health.
Okay.
There is nothing else like water intake is must. At least everyone should take minimum 2.5 to 3 liters of water to keep your kidneys hydrated well, so that there is no risk of stone formation, kidney stone formation. But apart from that, nothing is there.
Okay.
So mainly it is all about if you eat this, your kidneys will improve. If you eat this, your kidneys will improve. Nothing is like that.
Okay. So
there is no diet to improve your kidney health.
Okay. Okay.
There are diets which prevent your kidney damage. Like whatever you do for controlling your sugars, controlling your blood pressure, those diet you can follow to prevent kidney damage. But there is no diet to improve your kidney health.
Okay, that's the right thing to say, I think. Now, when you said water intake, again there is whole debate about how much water to drink, because there are people they think, okay, one is you will lose weight by drinking water, you're keeping your kidneys hydrated by drinking water, so they go on drinking water like 7 liters, 8 liters. They have some water therapy and all, where they drink some 11 liters per day and all that. So have you come across those things, and is that dangerous? How much of water is
so there is something called concept as psychogenic polydipsia.
Okay.
Means because of, as you said, they consciously they want to reduce weight, or they think it is good for health, they will be drinking more and more water. What will happen if you drink more and more water? Your urine will be very diluted urine, and over a period the concentrating ability of the kidney will go, and which results in electrolyte imbalance of the body. So there is a what we call as low sodium levels in your body. You will have sodium abnormalities. Because of this, sodium abnormalities will be there.
So how much is the limit, if you say that this much of water intake is good for your kidney health?
So as I said, around 2.5 to 3 liters is must. Up to 4.5, 5 liters is also not a problem.
Okay.
So like as you said, like 11 liters, and I think it may cause toxicity.
Okay. And another thing which is a major problem when you talk about information on social media is your naturopathy, and then you take this particular natural food or medicine, and then it will improve your kidney health. And there are many people who also advocate for different kinds of medicines like that. So what is your take on that?
So as I said, once kidney stage goes to 4 or 5, there is no going back.
Okay.
Because it is like our human body is also like one plant or tree. Organs also like plant. If you don't put water for any small plant or any crop, it will dry up. But after 10 days, if you put water, there will be a life in that plant again. But for 1 month or 2 months, if you don't put water, after that you flood it, there is no point. It is dead tissue. Similarly, our kidneys also, in the starting stages, in the stage 1, 2, 3, if you try to mitigate the problem, treat it and control it, then you can control and improve your kidney health. But once it is dried up, like dried up plant, whatever treatment you try, it is not going to improve. It's a dead tissue. Dead tissue can't improve.
So these herbal medicines that people talk about is not really worth trying in 4-5, and but otherwise is it okay?
No. Otherwise also see, as I said, glomerular diseases. So it is like you can't what I want to say is, if you have any kidney problem, first you should know. If you develop fever, what you can't
What is the cause
treat,
for it?
what is the cause for it? If you go to a doctor, he will see why you are having fever. Is it viral fever? Is it malaria? Is it typhoid? Is it dengue? For all fevers, treatment is not same.
Correct.
For typhoid, you have to take typhoid treatment. For malaria, you have to take malaria treatment. If you go to a Ayurvedic doctor or herbal medicine or any other thing, you have kidney problem. What kidney problem?
Correct.
See, if you have fever because of typhoid, your temperature will be 100. If you have fever with malaria, your temperature will be 100. Similarly, if there is a damage in your kidney, your serum creatinine is raised in the blood. Rise in creatinine means your kidneys are damaged. That's it. But what is the cause? What is the root cause? That you have to identify.
Okay.
So if you don't identify and treat that cause, what are you going to treat?
So how much ever amla you're taking, how much ever other juices you're taking, some kind of herbal thing, all that will...
How will it affect? See, each disease will have different. See, Ayurveda is, I have due respect for our saints and all. They are the masters who detected diabetes before Western world also. Madhumeha is there in Charaka Samhita very long back. But that time we don't have these glomerular diseases. Our saints, they know about kidney problem very way long back, only in centuries. But they don't know what is the cause of kidney problem. They just know about kidney problem. But we don't know, that time we don't know what is the cause of. As the science evolves, we are identifying more and more causes. Why not every kidney problem is same. Each person can have different glomerular diseases. There are some 30-40 glomerular diseases are there. So, and each disease will have different treatment
options.
And some diseases are completely curable. Some diseases are not curable, whatever you do. Some diseases are controllable. So each disease will have different treatment. So without doing biopsy and see what type of glomerular disease is, what is the cause, usually I will treat kidney disease means what are you treating? You are just fooling one person.
Okay. So talking about kidney stones, I mean that is something the moment majority of them have this problem. Why is it that some people have the tendency to have, they keep forming those stones? I remember I used to have that tendency, and one doctor told me my husband is into construction. So he said, stop producing stones. So for him. Okay. So like that, I'm just saying that what is it that actually leads to that, the formation of stones?
So as I said, one is poor drinking water. In general, if you don't drink much water, the kidneys will be forming like sludge. It is like if you have wash basin, if you don't wash hands with flush. Many people wash hands, and we see in hotels and all, if they don't use water properly, all rice material will stuck there only. If you put more water, it will go. Right. So our kidney is filtering complete waste.
Okay.
So if the waste product is with less water, that concentrated waste material can form stones.
Okay.
So you drink more water so that it will be in diluted form, and it will that waste material without any stones. This is general.
Okay.
So some people, as you asked, are more prone for recurrent stone disease. That because of some genetic abnormality, or some can have hormonal problems, something called as parathyroid. Everyone might have heard about thyroid. So behind the thyroid, there are some small 4 glands, what is called as parathyroid glands. These are the most important glands which keeps your bones healthy.
Okay.
So if these glands, like how your thyroid either work less or work more, if these parathyroid glands either work less or work more, your bones become weak, and there is increased levels of calcium in your blood.
Okay. Mm.
This whatever excess calcium, it will form stones in your kidney.
Okay, okay. So now this, the tendency to form stone when that is there already for these reasons, then is there anything to do to prevent those things at all? Like, can we actually prevent forming of these stones?
Yes. So, like as I said, there are some certain criteria where we see which patient needs to be thoroughly evaluated.
Okay.
Like as you asked, recurrent stone formers or family history of stones or very young age, like in 10 years old, 12 years old, a 3-year-old kid. Such people usually not form stones. Usually it's in middle-aged
stage.
adults only form stones. Huh? Young adults and adults don't form. Such patients, we have to screen any specific genetic problem or any hormonal problem or any abnormality in the blockage in the kidney. Huh? If kidney any blockage is there, urine is not draining properly, then there will be a chance of stone formation. So such patients we have to evaluate what is the cause. There will be a definite cause. Sometimes we have to do genetic testing. Is there any gene issues to see? And sometimes we have to give something called as hormonal therapy. Or as I said, if you have a parathyroid problem, you have to do surgery and remove that glands also.
Okay.
For recurrent stone formation.
Okay. Are there any particular professions that you see in your clinical practice that they come with more of kidney stones?
As I said, it is usually patients who live in a humid areas. There are particular tropical, even in across the world and across the country also, there are particular places where the environment is very humid. In such humid environments, more manual laborers who is drinking less water, these people will have more risk of stone formation because they will be reduced water. And there are some areas where there will be the minerals in the water. The water quality is not very healthy. The TDS is very high. Those patients also drinking poor quality water, they are also more prone for developing stone diseases.
Okay. I read in some of these studies that kidneys, the function of the kidneys also can affect because of the climate change and because of the hair.
Yes, there is something called as CKD-U,
Okay.
and chronic kidney disease of unknown origin. And in India and across the world, there is significant research is going on in some areas. Like you might have heard about Uddanam nephropathy, and there is a lot of research is funded by government of Andhra Pradesh in Uddanam of Godavari districts and Vijayanagaram that side in the that part of area. And there are in some areas like Tamil Nadu near in and around Pondicherry and all also. There are specific areas where population is at risk for developing kidney disease. One is because of climate change in the tropical countries with very humid and hot waves, and there is risk of uh, agro-pesticides, increased use of agro-pesticides, multiple factors the research is going. So there is a definite role of change in the climate which increasing the risk of kidney diseases.
Okay. We are at the beginning of the summer season.
Yeah.
Are there any tips for people to actually do to take care of kidney health?
Hydrate yourself, and especially don't drink more. What people do is they will take like now Pepsi, Coca-Cola and sugary diet, sugar juices, those things. Actually, sugary juices and all will further worsen your problem. You can have worsening of gout and uric acid problem. All those things will worsen. What you have to do is you have to drink more water. Maybe if you want not just water, you can try coconut water. It has more benefits compared to other these diet the sugary drinks.
Okay, okay. So if someone has a creatinine level which is slightly high maybe, but they are not feeling any symptoms as such, then is it okay to be ignoring that and thinking that it will get normal?
See, that is the what I am telling. So creatinine means it doesn't have any meaning. So you have to calculate based on the creatinine people think, many people, I ask, do you have kidney problem? Sir, I don't have any kidney problem. I'm healthy. Just my doctor told me my creatinine is 1.6, 1.5. He told me to see you.
Okay.
Huh? Uh, that is because he told me to see, because that is the right time to treat you. Once your creatinine is gone to 3, 4, there is no point of seeing me. You are ultimately going in for dialysis. To prevent further kidney damage, as I said previously also, in the first 3 stages, your creatinine 1.5, 1.4 means you are already in stage 2. Or if your age is more than 50 years, you are already in stage 3.
Okay.
So that is the correct time to see your kidney doctor and treat yourself. To protect your kidneys, that is the correct time. Many patients we see is, despite their physicians telling, please see once your nephrologist, your creatinine is slightly high, many will neglect.
Yeah.
And they will come maybe a year or 2 years later with severe kidney problem.
Okay.
In stage 4, stage 5 CKD, they will come. Creatinine doesn't have any meaning. You have to calculate into see what is your filtration capacity, and if your creatinine is even 1.4, normal is around 1.1 maximum is. So if your creatinine is even falling in 1.3, 1.4 means there is already some problem started in your kidneys.
That's
you
a red
have
flag.
to see. That's a red flag. There is problem. You have to see and you have to treat yourself. Otherwise, if the once severity goes, you will be in trouble.
Okay. So what actually happens in kidney failure? What is happening? Like, you have 2 kidneys, right? So, what is, if it's a kidney failure, then do we say it is a kidney failure for even one, or what happens exactly there?
So, what kidney failure is? As I said, the total kidney capacity, including both kidneys, the filtration capacity is 90 ml. So, when we say kidney disease and kidney failure, means your filtration capacity has gone down from 90 ml to less than 90 ml, and severe is less than 60 ml. That is significant damage. So, it means in combining both kidneys, your filtration capacity is less than 60.
Okay.
So, when we say you have kidney disease, you have kidney failure, it is in both kidneys. Your both combined kidneys, the filtration capacity is less than 60.
Okay. So, if in case of a kidney failure, then there is a chance of the person, do you start with dialysis for them? What is the treatment like when it is a kidney failure?
So, when kidney stage goes into stage 5 or anything, it is mainly without proper functioning kidneys, a human can't survive. So you need a functioning kidneys to make you survive. Okay. So either you have to do transplant by putting a new working kidney, or you have to be on dialysis for lifelong.
Okay.
So because dialysis is like a temporary thing. The permanent solution is transplant. Okay. Dialysis is like when you have power cut at your office or your home, you will manage things with having a generator or UPS inverter. Similar way, dialysis is also like that. Your own kidneys are not working and you don't have new kidney, so you have to make your life sustainable and you have to work. That is the where the dialysis come. But dialysis doesn't compensate whatever your kidneys do 100%. Okay. It is only make you live till you get a new kidney.
Okay. And every person who's had a kidney failure will need a transplant?
Yes.
Okay. That's the only way.
That's the only way.
Dialysis is like a temporary solution.
Till, like, if you have liver failure, unfortunately, if you have liver failure, you have to either get liver transplant or you will die. If you have heart failure, either you get new heart or you will die. But luckily for kidney, we have something called as dialysis, where till you get kidney, we can make you keep alive and healthy till you get one more kidney.
Okay. So is this dialysis actually painful? Because there's a lot of myth about, about dialysis. Actually, it's painful and then they don't go for it. So is dialysis actually painful? And also there is this thing that, oh, once you've started dialysis, then it's like the end of it. You can't come back to, stopping it. So are there situations where you can actually, suppose somebody has hypertension or, a diabetes and they have kidney problems, but then you put them on dialysis, but then you can actually stop dialysis and come bring it back to normal. Does that
Yeah,
happen?
definitely.
Okay.
That is when you got what is called as acute kidney injury. All this while we were talking about what is
Kidney failure.
complete
Failure.
damage,
Okay.
permanent damage. That is chronic kidney disease.
Okay.
There are conditions like acute kidney injury. Means your kidneys are till yesterday it is functioning well. All of a sudden today your kidneys are damaged.
Okay.
So your kidneys is damaged. It could be because of you have some severe heart attack, or you have severe infection. Your BP has come down, and you have continuous vomiting and diarrhea because of there is no water in your body and your kidneys are shut down. Or if you have taken any painkillers or some diseases where your kidneys has uh, damaged for a time being. So if you treat those diseases and if you treat those things, slowly your kidneys start functioning well. So for such patient, as I said, dialysis is a temporary life support therapy. So if you don't have functioning kidneys, you are going to die. So till if your own kidneys start working, you have some treatment, you need some support. That is where dialysis comes in. So in acute kidney injury, we will give dialysis as long as your kidneys are not improving. For that, maybe you need 1 week dialysis, once or two times dialysis. For sometimes you may need 4-5 times dialysis. Sometimes you may need dialysis for up to 1 to 2 months also. But over a period after 1-2 months, once your kidneys, that whatever disease caused your kidneys and we have taken care of and kidneys start improving, then you don't need dialysis.
Okay. So is it painful? Is the process painful?
Dialysis, there are two dialysis. One is hemodialysis, where we take out the blood of the patient and send it to a machine externally, and again we'll send back to
The
patient inside. This process, it's not very painful, but little bit painful because you have to put needles into your body. It is like giving injections, two injections. That injection pain will be there.
Okay.
That is this thing. And sometimes you may feel tired in hemodialysis.
Okay.
There is something called as peritoneal dialysis, which is not completely, it is painless because it is you can only do, a patient only can do at home, no need to come to hospital also. Hemodialysis, they have to come to hospital, someone has to be there to take out the blood and send, and you need separate mission. In peritoneal dialysis, we do something called a small operation and put one pipe into your tummy and we'll keep it outside. And like glucose saline bottles we get, we'll have a special solution called PD fluid, which we send that glucose bottle, glucose fluid into your tummy through, just you have to connect like a tap connection. That glucose you have to outside external you will have from your tummy, you just have to connect it. This will go into, that fluid will go into and you disconnect it. There is no pain. It is completely pain free.
Okay.
For this we suggest for everyone, and most like especially elderly who can't come to hospital, and for children who has to go to school, for these people we do we suggest, we recommend PD is best option rather than coming to hospital, hemodialysis and all. It will take their time and it will cause more discomfort, but peritoneal dialysis for children and elderly, we suggest. It is a completely pain free procedure.
Okay. So for some, can we actually live with one kidney, like And
Yeah.
So
See, around 1 in 1,000, 1 in 2,000 kids by birth, they will have either one kidney or only one functioning kidney. Even though two kidneys are there, one kidney might have completely damaged and they don't know. and they don't know about they have only one kidney till they reach maybe 40 years, 50 years also. When they will go to some other test or employment checkup or some other non-specific reason, they will go and they will do scan, they will see you have only one kidney or one small kidney. Many conditions we'll see like that.
Okay, so now suppose somebody is like a living donor, you've donated the kidney, then can that person live comfortably with just that one kidney?
Yes. So living donor, if you have any kidney failure patient in your family, we encourage family members to donate kidneys so that the kidney failure patient live happily for a long time, and the person who has donated also will be healthy. For that, we will usually run a lot of tests. See, compared to the patient who is taking kidney, we will run more tests in the patient who is giving kidney. So this he is the best. It is like taking out your best of human species. It is the best healthy person. If a person is eligible for kidney donation, means he is the most healthiest person. So we run all sort of liver, heart, brain, all sort of kidneys test, or whether how much is one kidney is functioning. If we take out one kidney, is the other kidney only sufficient for him or not? We'll do all these tests, and if we feel he is safe, then there is no risk for kidney donation, and they will be live normal life, normal professional, social life, everything they can live like previously how they used to live.
Okay. So if the governments, it's very rare that we actually talk about governments getting involved in kidney health per se. There is a lot of programs which happens for otherwise, there is cardiac and all those things. There are so many programs from the government per se. But if you're requesting the government to get involved and do something, what is it that you think that it's important that the government should take care of?
See, government should take care of mainly preventive health diseases, because so this is something where you have to check kidney early, and you can prevent also, completely cure also. See, I think they have to do more awareness campaigns about kidney disease per se. Many common people doesn't know about the kidney damage and its complications, and whether when they have to check, they doesn't know. So they have to run awareness campaigns already through Noto and Soto. They are running enough organ donation. They are doing. They are doing. There is over the at least in the past half decade, there is a significant improvement in awareness campaigns about organ donation. But that is in only in the secondary or tertiary care, where already patients are suffering from kidney failure. But before that, there should be a mass campaigns how to take care of their kidneys.
Correct. Okay.
And I think government should engage with more celebrities or some persons who are actually suffered from our late Sushma Swaraj ji or Arun Jaitley ji. They all have Lalu Prasad ji now currently is intervened. They should be mass campaigners for kidney health, so that more it reaches to more masses. Why I'm telling this, because whenever there is a news of some celebrity has died because of cardiac arrest,
there is so much talk.
There will be so much talk, and people will flood into the hospitals to check their heart. Okay. Like recently, our beloved Puneet Rajkumar sir has died. That time, every hospital cardiology department is full with young people with normal, no risk factor. Okay. But they are still in cardiology to check how is their heart. But we have read the news about Sushma Swaraj ji and Arun Jaitley ji or Lalu Prasad ji getting kidney transplant, but there is no buzz of whether we should. People think, yeah, they got kidney failure, they got transplant, but no one is talked about. Should I also check?
Correct. Yeah.
That intention is not coming to the. That is not coming to the minds of the general masses. That should come.
Correct.
You might have seen when what happened with our beloved Puneet Rajkumar sir.
Yes.
That time all hospitals.
I totally agree with you. That is very important.
Everyone has gone, and they proactively. No one told, even government also didn't tell people to go and check your kidneys also.
Correct.
Uh,
So likewise, when you're talking about, I forgot to ask this question about diet when you talked, and also about the protein. So is it true that, when you eat non-vegetarian food or when you eat a lot of protein, that damages your kidney? Is that what it is?
no, see, patients with the kidney disease should not take excessive protein,
Okay.
but they should take limited protein.
Okay.
What we see is, whenever we say, I don't know how it went into the masses, whenever we say you have kidney damage, sir, shall I stop all protein including the dal? That is what we get. Patients only will tell. Before we tell, they will only, sir, shall I top every protein? That's actually will have negative effects.
Okay.
For you to be healthy, you should need at least some protein so that you will have good muscle mass and you will be actively working. So if you don't have muscle mass, you don't take protein, it will have problem. So, but again, excess is not good.
Okay.
So even in normal patients also, for a young adult, 1 gram per kg body weight protein. So if a 60 kg person, he can take up to 60 grams. Or if he's into some modeling or any this thing, maybe they can increase 0.2 or 0.3 grams extra. 1.5 grams maximum they can go, but it should not be very excess also. If you take more excess protein, again, as I said, there is an increased load on your kidneys and it can cause more stones also.
Okay. So are there any foods, like, you're talking about non-vegetarian, excess non-vegetarian in people with kidney disease and also people who are normal.
Yeah.
Are there any foods like that people with kidney disease should avoid?
So usually patients with kidney disease, we encourage them to take plant-based protein.
Okay.
Plant-based protein, but they can take lean meat or egg. Those things they can take. Overall, they can take up to 0.7 to 0.8 grams per kg body weight. Means a 60 kg person can take up to 40 grams per day protein. That is not harmful to their kidneys and it is safe.
Any other vegetables that they need to avoid or anything of that sort?
So, not every patient, but some patients with severe kidney disease, they are more prone for high potassium levels in the body. High potassium levels lead to sudden cardiac arrest, sudden death. So their potassium levels should be within the normal. So we advise patients with severe kidney problem to limit diet which has potassium. Like in our Karnataka, the most staple food, especially old Mysore region under, is the mudde, ragi mudde.
Yeah.
So we have seen patients requiring dialysis just because their potassium is high.
In
Because-
ragi, there is.
Yeah, ragi is high potassium content.
Okay.
So most of the, as I said, diabetes patient will eat more to control their diabetes. They will eat ragi mudde. If they have kidney problem, they will have more high potassium.
Oh.
So some patients with severe high potassium levels, just because of potassium to remove, we have to give dialysis temporarily.
Okay.
Such emergency situations also we have faced. So potassium, like high coconut water, green leafy vegetables, banana, now summer coming, mango, all these are potassium rich foods. Dry fruits, all these are potassium rich. Such foods, patients with severe kidney disease better avoid very high potassium rich diet.
This is for severe kidney disease,
Yes.
not for people who have the tendency to form stones or who
No,
have.
no, actually patients with tendency to form stones, they have to eat more potassium.
Okay.
If they have normal creatinine, kidneys are not damaged, they are just stone formers. To prevent stones, they have to eat more potassium rich diet, less salt, more milk products.
Okay.
Many people will think, I have stone disease, I should not drink milk and dairy products or calcium rich food. But that is reverse. They have to take more calcium diet, because whatever stones most commonly we see is called as calcium oxalate. So the culprit here is oxalate.
Okay.
So these oxalate products, like in green leafy vegetables and all, these oxalates will get absorbed into body and it will form stones in the kidneys.
Okay.
So to prevent absorption of calcium oxalate into our body, to prevent absorption in the intestine only, you have to drink more calcium. If you take more calcium, whatever calcium is there and whatever oxalate you are eating, it will both combine in the intestine only, it will come out in the stool. It won't enter into your blood.
Okay.
So stone formation is risk.
Okay. What about your supplements? Like, are there, for all the other organs, we have so many supplements. So for kidney, is there anything of that, sir?
There is no need for supplement, but we have seen enough adulterated protein supplements and in especially gym goers, we see high protein intake along with there are adulterated these things, some chemicals and all will be there. This will actually cause more kidney damage.
Okay. Doctor, any last message you have for our viewers today on it's Kidney Day, and anything you want to talk about?
My main message is that the theme goes, are your kidneys okay? So as I said previously also, who has risk factors like diabetes, hypertension, obesity, family history, please check your kidneys how it is working by checking serum creatinine and urine protein. If you have any problems, consult your kidney doctor and take care of your kidneys. Maintain healthy life.
Thank you very much, Doctor. It was really wonderful speaking to you.
Thank you. It was very nice meeting you. It was a very nice talk, very interactive session, and I also felt it is very nice.
Thank you very much, Doctor.
Thanks.
That is all we have for today. See you next week in the next episode. Thank you.